Welcome to the Mental Edit, where we keep it real, unfiltered, and honest, because mental health is complicated. I'm Megan.
And I'm Rachel. We're here to have candid conversations about mental health, what it is, what it isn't, and everything in between.
The Mental Edit is for educational and informational purposes only. We are mental health professionals, but this podcast is not therapy, medical advice, or a substitute for professional treatment. If you're struggling, we encourage you to reach out to a licensed mental health provider. And if you're in crisis, please seek immediate help from a trusted professional or emergency services. Now, let's get into it.
Welcome back to the Mental Edit. I'm Rachel.
And I'm Megan Albanese.
And on this episode, we are going to talk about when to know when to seek help.
Who to reach out to.
Yes. So mental health care can be very overwhelming. It can be confusing. And let's be real, it can be very intimidating to think even about making that phone call. Or as I always say, just text me or email me. But and we're here to break it down to when to actually know where to start.
And also the barriers to care of sometimes what stands in our way from getting help or the help that we deserve or need. So let's get into it. When do you know it's time for help?
So I think a lot of clients, firstly, if you're having that question in your head, it's probably time. If you're feeling, what we learned how to figure out. So everyone experiences some level of anxiety, depression, stress, moodiness. But if it starts to impact your daily functioning, your sleep, your ability to concentrate at work, you start noticing irritability. And a lot of times your loved ones will give you lovely feedback that you are snappy or irritable, or you seem really reactive. Sometimes it comes from your kids. It can come from someone at work. So if you're getting that kind of feedback on yourself, that's probably time to seek help.
Yeah, I say anytime there's a stray of baseline, so we're not acting ourselves, and I use the saying stage versus trait. Is this something that we're just feeling in the moment, whether if it's a couple of days of insomnia related to holiday stress or stress related to a presentation at work, or is this something, that's becoming more prevalent in our daily life, that we're not sleeping for multiple weeks? Or is it anxiety or panic where we have this one bout where we're just really anxious before our yearly review? Or is this becoming more prevalent where we're showing road rage and irritability? And I do agree that usually when someone calls us out or has that feedback, it tells us that this is starting to become more of a trait than a stage, and we should probably reach out for help. Let's talk about psychiatrists versus NP.
Okay.
So a psychiatrist is an MD. They've been through med school. They've been through their residency. A lot of them have been through fellowships, very well trained, very medical background.
Yeah.
A science model of thinking how to get to A to B. And it's great. I've learned so much from so many psychiatrists that I've collaborated with, and I'm so grateful for them. And I think what they do is awesome, but it's a lot different than a psych NP. So the NP is a more holistic approach because I have that nursing background. My personal background isn't actually psych.
That's right.
Yeah. I worked on a medical surgical floor for a year doing plastic and post ostomy surgeries. So I love changing ostomy bags. Cool. That was my fun fact. Yeah. And then I wanted to see the other end, and I went into the operating room where I did pediatric plastic and burn surgery. And in surgery, you're not talking to people. And that's when I realized, hey, I miss the chit-chatting, and went back for psych. So my background is different. The medical knowledge is there. The training's a bit different. Grad school was 3 years, a lot of clinical time, residential programs, the whole gambit. But how I get to my diagnosis or treatment plan is different than how a psychiatrist would get there. And it's just because the model of training that we were provided with, and not one is better or worse than the other.
Yeah. Yeah. So, essentially for a mental health therapist, like psychotherapy week to week, it's really about who you click with. Yeah. And, a lot of therapists specialize. So it's worth putting that into psychology today. You can sort by what you would like to focus on in therapy, and you can find someone that specializes in that.
I want to talk about knowing it's a good fit before we talk about life coach.
Okay.
I tell my patients, because I'm usually the one helping them find their therapist, is 3 strikes. If you don't have 3 good sessions, time to find someone else.
That's a good rule.
And I use the hairdresser analogy.
Oh, I don't think I know this one.
Just because you might not want to see my hairstylist. I might not want to see yours.
Yes.
Doesn't mean you have bad hair. Doesn't mean I have a bad hairstylist. Just not a good fit.
Yeah.
And that's how it works with finding a therapist. Just because your first 3 sessions didn't go well and you're looking for a new provider doesn't mean you did therapy wrong or you're bad at therapy. Doesn't mean that therapist or psychologist was bad at what they do. They just weren't a fit, and we move on.
Yeah, and I tell clients, even when they call for the first session, that it's a relationship. So the first session is really getting to know each other. And I do check in at the end. How was this for you? Did this feel good? You want to think about it? Like, I put absolutely no pressure to schedule the second session, because I do think people need to process, because a lot happens in the first session. So yeah, it's like a relationship, like anything else.
How would you know, you think, as a patient, that it was a good first session?
Usually we laugh a little bit. Or actually, my favorite thing that they say is like, oh my God, I feel so much better. Or I have a lot of things. Or I like when they say, oh my gosh, I've never told anybody that.
I love
that. Always gives a chill. That brings me, like, I always get a chill when they say that. I'm like, oh my God, me?
I do really enjoy that.
Yeah, I love that.
I think I also know I had a good intake with a patient when they feel confident, and you can just tell after that first appointment, the way they walked into the office and the way they leave that day are a little bit different.
Yeah.
And I think that's really cool to just witness. And usually how they come back for their next appointment, even their body language is a little different.
Yeah. Or if they tell you, like, I was really looking forward to this. That's always really cute.
I love that one.
Okay, I do think it's important for us to talk about life coaches, because they are everywhere.
Why do we think they're everywhere?
Well, I'm trying to be respectful.
What does it take to become a life coach?
Actually, nothing. I think you should be wary of any profession where you can just, or any job, or any, like where you could just wake up one day and declare yourself that thing. So
declare yourself an expert in motherhood without any formal training, certifications, or license.
Yeah. So, everyone kind of knows that it takes a lot to become an NP, an MD, but probably what most people don't know is it also takes a long time to become a therapist. So you do graduate school for 3, sometimes 4 years if you can do full-time versus part-time. And then you do hours. So you have to work in the trenches, really, community mental health, really intense caseloads, really little pay.
With guidance, which I think is important. So yes,
so
it's
you have
experience,
a supervisor,
but it's so important that we state that we have experience with guidance.
Yeah. So whenever people ask me, like, how to become a therapist, I make sure to remind them it's a 7 to 8 year process just to get your practice started, or to even join a group practice. So anyway, life coaches.
How I view a life coach, they're influencers right now who are really trying to take off on social media. They're posting their journals and gratitude journals. Great, awesome. Trying to sell them and get you into their program, which I'm sure there is so much beneficial knowledge from someone who's been through grief or postpartum. And there's a support community, which I love community. Yes. But when it comes to really advising someone, there's no formal background there, or training, or certification. And also, we have a license to lose.
Yes.
We have our license on the line. We can lose our license. And really, someone who's a life coach doesn't have that license to lose.
Yes. Yeah. We have to renew our license. I have to renew it every other year. I have,
and that goes with courses and credits and
CEs,
different.
And I have, most therapists are encouraged to join boards or associations that they report to also.
There's a reason that health insurance will reimburse for therapy and not for life coaches.
Yes. And life coaches can be helpful. I just think that it's important always to check credentials, right? See if they have master's degrees, see if they have any certifications, and then go from there.
Yeah, so maybe it's a good place to start. Maybe you're just getting some good information from them online, but meeting on a regular basis and really exposing your life and some large decisions to this life coach. They might be coming from a place of sincerity and goodwill and good nature, but it might not be the right choice.
Yeah, and this makes me think about boundaries too, because a real core component to therapy that any therapist will tell you that we learned in grad school is boundaries. So how to hold emotional boundaries, how to not put too much of yourself into sessions.
Barriers to care. There's sometimes reasons why a patient can't reach out. They aren't reaching out, one of them is, I didn't think I was bad enough, or I didn't feel like I was sick enough. So let's talk on that. When is too early or late for you as a therapist for a patient to reach out for help?
You can reach out to me anytime. I see a lot of perinatal, mom, maternal mental health clients. And sometimes they reach out to me like with a positive pregnancy test. And that's my favorite because I'm often, the first person that they told. And we get to really go through the whole journey together. But for me, it's really never too late.
You also say couples. When should couples reach out for help?
Well, couples are tricky because the stat on couples is that they come 7 years too late, so to speak. So couples is an interesting, we'll probably do a whole episode.
Yeah, we'll do an episode on couples.
Couples is interesting because, the longer you wait to come, the more entrenched these fights and beliefs about your partner are. And a lot of times in couples, what I'm trying to do is like rework how you look and regard each other to kind of reduce conflict and start working more as a team. Yes. However, a lot of couple issues start after you start having kids. And then the irony of that is the time when you have no time to come to couples therapy. So if I ever get couples when they have little kids, I'm like, this is so great. You're prioritizing this. I know it's really hard. I know you don't have the time and energy, but this will really help you.
Yeah. I'm going to go back to another gym analogy. So we talked about patients not being sick enough to attend therapy or reach out for medication management. I use the analogy of the gym. We don't only go to the gym if we need to lose weight. There's so many different reasons to go to the gym. Yeah. Stability, gain weight, lose weight, good endorphins, balance, rehab. There's meet a partner, just waste time. We go to the gym for different reasons. There's different reasons to reach out for mental health help, and it doesn't need to be because we're broke or we're in crisis.
Yeah.
Coping skills, grounding skills.
Yeah, and some of my clients just need space to air out some frustrations they have in their life or talk through some childhood issues or, mother issues, mother-in-law issues. It's kind of just a space for you to talk about whatever you want with an objective. I always joke, I'm not really objective because I'm always on my client's side, but technically I try to be objective.
Yeah. Barriers to reaching out can also be insurance, which we talked about, calling for insurance. It could also be stigma. Yeah. So how do we break the stigma around reaching out? And I think it's like what we're doing today, having open conversations. I see, and this is another way we're different.
Yeah.
I see a lot of mother, son, friend groups, two siblings. I see mother and daughter. I don't see them together, but because there's that medical, it's not a conflict in care where you can't see people. No. So breaking stigma within the family or the friend group and saying, hey, I see Meghan. I feel really comfortable seeing Meghan. Maybe you can give her a call. Yeah. That's more appropriate. You can't see patients that way.
No, I have been passed from one client to another, but I have tried to see friends before. It just doesn't work. Even if you don't mean to talk about them, sometimes that person comes up, and it's really important for me not to have like outside information on a client that they didn't really consent to.
You need to be unbiased.
Yes. So, I can't even see my friends' friends. I prefer to see I want to be like 3 times removed from that. And I think we've come a long way in the last several years, with the pandemic. What happened was we were having a collective experience of mental health struggles, right? With depression, anxiety, really high levels of stress, panic. And I found everyone people were finally experiencing anxiety, stress for the first time. So people were talking about it more. People were reaching out to therapists. Like we had a boom with therapy for a very long time. And I felt like people were saying more and more, I go to therapy. Like I had a client shout me out at a work thing this week and I was so touched. I couldn't believe it. So, I think also talking about your experience with therapy and being open about, why you go to therapy or what you learned from it.
Another barrier to care is coming into the office, especially if you're a working professional. And now we have the flexibility also a lot because of COVID-19 of telehealth. And do I prefer my patients in the office? Yes. The intake, I insist on seeing you in the office. But what a beautiful thing to have the flexibility of meeting with your provider on a lunch break, or if you're sick at home, you can still log on and we can have our session.
Yeah, that's been really nice, especially for working parents, including myself. I can kind of set my schedule during working hours, which is nice because people slot me in on the lunch breaks, like you said. So that's been really good to increase availability of therapy. Yeah.
Any other barriers? I mean, write in, comment, DM us on Instagram if you feel that there's a barrier to care that you want us to discuss.
Another place we differ a little bit in our approach is readiness. So say a little bit about when patients are like ready to see you.
I don't feel that a patient needs to see me when they're ready to start medication. I mentioned it in our last episode. A patient can come to see me just to be educated on what's available to them or what could help them. It's a starting place. So coming to see me and walking into a psychiatric office doesn't mean you're signing up for medication that day. It's more, I feel, the goal to be informed and educated, and no matter what, knowledge is power. So what could help you? How can you be helped? And it might be referrals. I might say, hey, let's first have you see a sleep specialist and get tested for sleep apnea if you're low on energy. I might make a referral over to neuro for cognitive testing for ADHD before I just prescribe a stimulant. And then I'll probably say, what's your thoughts on therapy? And hey, when do you want to meet again? Is it in a month? Is it in 2 months? I sometimes even handwrite a patient a script, because usually I e-scribe, and I'll say, hey, take this with you.
Yeah.
If you feel, let's say we talked about Lexapro 5 milligrams at nighttime. If you feel like you do want to start it, you've received the full education today, feel empowered to fill it and start it. And if not, come back and talk when you're ready, and we can see how I can help you next.
In therapy too, it's very easy to chit chat, and I am a big chit chatter. And I do need to check myself a lot, because I will talk about Beyonce tickets or like where you went to dinner with
Rachel. I call patients out because I ask every session, I'm like, what are you working on in therapy? Yeah. And I'm like, is this becoming coffee talk, pity and praise? And they look at me.
Yes, I've never heard that. Yes.
But I also think it's important to have that foundation. Some therapists might disagree, or mental health providers, but I think some form of connection or understanding, whether it's Beyonce or T-Swift or football, like let's be able to talk about a little something so you know I'm human. So I hope after this discussion, there's a little more insight on when to get help, who to see for help, and addressing some of the barriers that are standing in your way to help. We're all deserving of help.
Yes.
Believe in it.
Yes. And I think, you know, as we had highlighted, it is a scary thing to walk through the door, to sit in the waiting room, or even to sit there on telehealth waiting for your therapist to connect. But it can really, you know, I guess what the part we're not really talking about is it can be the most beautiful journey. I have seen clients transform, and, you know, it's interesting about therapy. Those wins are not as frequent, right?
We shared such a big win yesterday, and I almost wanted to cry between a mutual client.
Yes. And, you know, I
set you up. Well, we won't get into that.
You know, like on like TV shows and movies, I think they show these really pivotal moments in therapy, and those are few and far between. So that's why therapy is work. To get those breakthrough moments or moments of recognition and gaining insight, it does take a lot of work and time and effort.
The trajectory isn't always just straight up. There's some hiccups. And let's say we're working on a past trauma. You might come in that week with the problem of the week, and we need to take a step away from the trauma.
Yeah.
So seeking help, finding the right help, it takes time. The word I keep using is vulnerability. We need to be ready.
Yeah.
And when you're ready, Rachel and I are here.
Yeah, we're ready for you.
And we hope that your journey is exciting and beautiful and all the great things to help you get where you want to go, or enjoy where you're at.
Thank you for listening. Make sure to subscribe to The Mental Edit and turn on notifications so you never miss an episode. Give this video a like if you found it helpful, and drop a comment with your thoughts or questions. We want to hear from you. You can also DM us on Instagram at The Mental Edit with topics you'd love for us to cover. And if this episode spoke to you, share it with someone who needs to hear it. No fluff, no BS, just real talk about what healing actually looks like.